Be advised, the opinions and views of the hosts and guests do not reflect those of the station.
Good morning, Philippines. You're watching the Business Portal, your gateway to health and beauty trends and opportunities. I'm your host, Dr. Jan Cenica for What's Up, Doc? Yes, and we have a very interesting topic for this morning. We call it Doctor Knows Best. Okay, and before anything else, I would like to introduce to you first in the history of television. It's a father and daughter theme. Me and of course my daughter, who is an intern at Quirino Memorial Hospital, and it's her first year in internship, and probably next year who will be my already a recognized licensed physician, and no other than my daughter, who introduce you, Dr. JONNA May Cenica. Good morning,
hello, good
sister.
morning, Dad.
Yes.
Good morning, everyone, and welcome to What's Up, Doc. And it's an honor to be hosting with you, Dad, and to be here at What's Up, Doc.
Yes, and I know you have to do it best, or else you will not be here next week.
I
okay?
know. I'll try my best.
But you know, we have two good-looking, and I could say one of the icons
Yes.
in cosmetic surgery of the Philippines.
Two of the most popular
Correct. Yes.
surgeons.
First is a fellow of the Philippine Academy of Aesthetic Surgery and medical associates of Johnson Cosmetic Surgery, and the president of the Philippine Academy of Non-Surgical Aesthetic Cosmetic Surgeon, no other than Dr. Lester Abeleda.
Good morning, Doctors Jan and Jonna May
Hello,
Cenica,
good morning.
the most famous father-daughter tandem.
Thank you very much. Yes, and I know you're the president of the Philippine Academy of Non-Surgical Aesthetics. Probably, I know that you'll be having a workshop, right?
Yes, we will be having a workshop on July 14 and 15, 2011.
Oh,
This coming month.
We'll discuss
Wow.
about that. Next is a I can say an icon in cosmetic surgery. I could say the fellow of the Philippine Academy of Aesthetic Surgery, and I could say the head of head fellow of the Shimyan Manila, one of the famous cosmetic surgery clinic in the Philippines and in Korea. No other than a celebrity look-alike and a
A
celebrity
very
name,
good-looking doctor.
good-looking guy. No other than Dr. Mark Fernandez.
Hello,
Morning, Mark.
Hello, Dr. John and Dr. Jonna. Advance happy Father's Day.
Yes.
Sakto talaga yung
Yeah.
first day ng hosting.
Sakto.
Dr. Mark Fernandez, you don't look like a doctor, you look like a celebrity.
Yes.
Kaya, Doctor, nagsuot ako ng white coat today para hindi mapagkano.
O sige, sakali hindi ka naging doktor, ano sakali ka ngayon?
Doctor, nasa Hollywood siguro.
Akala ko, ano lang eh, local lang tayo eh.
Umpisa pa lang yan.
Hollywood na
That's
kagad
why,
tayo.
for our
Sige.
televiewers, you can text your questions and comments to our cell phone number at 0922-891-6761. And we are broadcasting live here at Global News Network, the
Yeah.
only channel talking about aesthetics and health and beauty topics and cosmetic surgery.
Yeah, so if you guys have questions, anything about beauty, anything about cosmetic surgery, just text in your questions.
Yes.
Again,
The cell phone number is
0922-891-6761.
and please indicate your name and location. It's very important for us. So we know we are all over the world actually, and we are broadcasting at Luzon, Visayas, and Mindanao.
Yes.
We're channel 8 at Destiny Cable, and I think channel 1 in our cable, satellite TV. Okay. Now, let's start the ball rolling. Our topic is
Yes.
all about nose job, nose
A
lifting.
very interesting topic actually, because
Yes.
I've heard that a lot of people here in the Philippines are actually very interested in nose lifting or rhinoplasty.
Correct.
Diba?
And we are all Orientals, and majority of us want to have a Caucasian look.
Yeah. Trademark kasi nating mga Pinoy yung mga ilong natin eh.
Yeah, exactly.
Diba?
Okay, Dr. Mark, what is rhinoplasty?
Rhinoplasty basically is enhancing the nose. The nose is a very important organ. It's in the center of the face. That's why a lot of our patients seek rhinoplasty. So rhinoplasty for the Filipinos is usually augmentation rhinoplasty. We put an implant to enhance the bridge and also to improve the base of the nose,
Yes.
or alar base surgery.
Oh, okay. Now, when you say augmentation, you mean that sa Tagalog pagpapatangos ng ilong.
Yes, pagpapatangos ng ilong.
And
Dagdag.
I could say it's a trend, it's a
I know,
fad.
it's a trend.
Diba?
Yeah.
Diba, daughter?
Yes,
Doctor, I
Dad.
mean. It's a fad already of having a nose. So, before, way back mga early 70s.
Taboo dati itong topic na to eh. Like,
Yeah.
not everyone would admit that they had a nose or their nose done, di ba? Very taboo ito sa mga Pinoy kasi medyo conservative tayo pagdating sa mga ganyan. Pero ngayon, it's already a trend. Like everyone,
Yeah.
everyone who's had it says it to her friends, ganyan-ganyan. Hindi na siya
It's a
taboo sa
it's a
atin.
status symbol.
It's a
eh.
status
symbol,
symbol,
yes, it is.
exactly.
Kasi, of course, the price of a nose job, it's not really that expensive, but of course you have to save
It's just
money
like a
for
cell
it.
phone.
Yeah, it's like a cell phone. But, once you have it, parang, it's a dream comes true for a patient. Dr. Abeleda, okay, I know that you're doing a lot of rhinoplasty at Janssen, and we know that how many percentage in comparison, or ratio in comparison with women and men having rhinoplasty or nose job?
Well,
Women's are usually doing the rhinoplasty more than the men, and the ratio is around perhaps 7 or 8:2.
Oh, okay. So that means like around 20 to 30% of men have already had
Yes.
rhinoplasty.
mas vain pa rin ng women talaga.
Yeah.
Yes.
Siyempre. Oh. Now, who are these patients who wants to undergo rhinoplasty?
Usually those who are like who do not have any losing self-confidence, for example,
Yes.
is very low. Who has very low self-confidence, and those who want to improve his or herself. Those are the people who usually seek rhinoplasty.
Okay. Now, when you say women who wants to have a rhinoplasty, and is it like when a patient comes to you who seeks for a procedure, like a nose job, do you do right away at the same day, or you could just assess them? And do you have any like computer imaging, set them up for computer imaging for them to see the before and after, Dr. Fernandez?
First and foremost, if it's the first visit of the patient, of course, it is very important that we know the medical history of the patient. We take in
Yes.
the medical history if the patient is taking any medication, any underlying diseases. And after that, we ask the patient, coming from the patient's mouth, own words, that, Doc, gusto ko pong baguhin. It's not us, the doctor, telling the patient pagpasok, kailangan mo nang, we ask the patient first, hintayin natin that they be the one to tell us what they want. And for us doctors, it is our role to interpret or to tell the patient what is the ideal procedure for them. Because other will go na, Doc, gusto ko ganito kataas, gusto ko kamukha ng ilong ni Jamie Foxx or ni Tom Cruise. Pero yung ilong walang-wala eh. So it's impossible. So with the patient's expectation and our expertise, magko-combine, then we schedule the patient pag nag-agree with the plan of surgery.
Oh, okay.
Yeah, I guess that's very true. Kasi some patients, they have like this expectations that you could actually have like Angelina Jolie's lips exactly, diba?
Yes.
Pero I've heard that it's not really true that you could like have a Xerox copy or a photocopy of Angelina Jolie's lips. It's just that you in cosmetic surgery, you enhance. Is that true? You
yes.
just enhance the body part. What's there is just enhanced.
We
Is that
we
right?
don't change the face of the person, but rather we enhance the beauty.
Yeah, exactly.
The beauty what they have right now. That's why our topic for this morning is doctor knows best. Dr. Abeleda, when you say a patient wants to have this kind of nose, sometimes patient come to you and have a picture of a celebrity and wants to have this kind of
Gusto
nose.
nila
Can
ipagaya.
you do that? I mean,
We have to be realistic. We have to tell the patient that you have a nose like this. For example, a nose like a well-known celebrity who is not so good, who is not that good. Then we tell them that this is the realistic expectation of your nose. We do not tell the patient that your nose will be like this, or because it is very very hard to sculpt the patient according to her belief or her whatever he wants.
yes. Is it that's a culture or say we have a patient before that the whole family wants to have a nose job, but hindi naman sila sabay-sabay. It started probably from the daughters, and then even the sons and the parents, and they want to change the outcome of their probably lahi or kulit lahi, you know, and of course we have to do some lectures or consultations to our patients, the expectations, you know, because there's sometimes they expect so much, and as I have said that sometimes they bring a picture of a celebrity and they thought that we are, ang sinasabi ko nga when we do rhinoplasty, we don't do it in like a computer or we don't do it like a clay. So we're dealing with human tissue,
Real people.
real people. Wherein we have to tell to the patient that the possible results, but not the realistic results. You know. And Dr. Fernandez, in your experience, did you have any experience of having like a problem after the surgery?
Yeah.
Even though, let's say, you don't have any medical problem or any complication, but the patient is not happy about the results. How do you deal with that?
Deal with that.
That's very common.
It is
no?
very important, yung initial consult pa lang, that you really screen the patient that she is or he is an ideal patient to undergo nose lift or rhinoplasty. If she has unrealistic expectations, of course, we will not push through, of course, with the surgery. What we do is either we jack up the price or we refer the patient to another doctor, the one that is not your good friend.
Yes.
Yes. Dr. Abeleda, do you encounter already patients who have like how do you encounter patients who have like what you call psychological problems? Something I know.
Do you usually screen patients
Yes,
psychologically?
At Janssen, we
Yeah.
usually
I
screen
guess that's very
patients.
important,
It is
no?
important to assess the psychological makeup of a
Yes,
person.
yes,
Like, for
exactly.
example, those who are having BDD or body dysmorphic disorder, a
Body
disorder, a psychological
dysmorphic
disorder of which the patients cannot be easily satisfied with their looks. They usually look at minor flaws in their face, in their body, or there are like unimaginary flaws.
Yeah.
And then they are usually not satisfied with the result of any surgery. So these are the patients who comes into your clinic undergoing repeated cosmetic surgical procedure.
They are not satisfied at all.
Yeah, they are usually
satisfaction.
unhappy.
Happy.
So from that psychological make, you can deduce that the patient is like having a BDD, and a BDD is usually a contraindication for any cosmetic procedure at all.
Right.
About patients who, you know that sometimes patients come to you who had already these injectable materials in their nose. So, and they've been done by somebody who is unscrupulous. When I'm saying
Not
unscrupulous,
even a doctor.
not even a doctor, not
Yes.
even a nurse, but rather
Very common yan, no? Very
yeah,
common sa
oo, and
Philippines.
it's very, sabi nga nila, the price is even very, very cheap, like probably like 5,000 pesos. You can have a nose job, but the thing is, it's an injectable material that was being injected in the nose. And can you explain to me, like these people who had undergone this kind of procedures, and what kind of material are they